Did you know that up to 30% of men who take Tadalafil for erectile dysfunction see no improvement at all? It's not because the medication doesn't work, it's because of a few critical habits that completely cancel out its effects. In today's video, I'm going to reveal the top 5 reasons why Tadalafil might not be working for you, even if you're taking it correctly and are otherwise healthy. These are science-backed explanations that every man should know if they want real, lasting results. So stay with me, because this could make all the difference in your treatment. Hi, this is your Dr. Fiona, a sexologist and urological surgeon. I specialize in treating both male and female patients with concerns related to sexual health and the genitourinary system. And in this video, we'll be discussing why Tadalafil, a well-known and scientifically validated medication for erectile dysfunction, doesn't always work for everyone. Although Tadalafil is remarkably effective, with clinical studies showing that between 75% and 85% of men experience significant improvements in their erections, we still see around 15% to 30% of users who report little to no benefit. And many of these men are otherwise healthy and take the medication correctly. So what's going wrong? In this video, I'm going to walk you through 5 common situations or habits that can interfere with the effectiveness of Tadalafil. But before we do that, let's take a moment to understand how this medication works. Now, most of you already know, Tadalafil is a phosphodiesterase type 5, PDE5 inhibitor. It functions primarily by increasing the availability of nitric oxide at the cellular level. Nitric oxide is the body's most powerful natural vasodilator. It relaxes and expands blood vessels, thereby improving circulation, particularly in the pelvic region. This mechanism enhances the flow of blood into the penile tissue, resulting in a firmer, more sustainable erection. However, it's important to clarify that Tadalafil is not an erection inducer. It doesn't initiate an erection on its own. Rather, it acts as a facilitator, enhancing your body's natural ability to respond to sexual stimulation. This means a man must still experience desire or sexual arousal for Tadalafil to produce its intended effects. So why does the medication sometimes fail? Let's examine the 5 most common reasons. First, drug interactions that inhibit Tadalafil's efficacy. Certain medications can reduce or completely negate the effects of Tadalafil. For instance, several anticonvulsants, including carbamazepine, phenytoin, and phenobarbital, increase the activity of liver enzymes, particularly cytochrome P450, which accelerates the breakdown of Tadalafil in the liver. The result is a significantly shorter duration of action and reduced drug effectiveness. A similar issue occurs with antibiotics like rifampicin, commonly used to treat tuberculosis. It also induces liver enzymes that speed up Tadalafil metabolism, reducing its availability in the bloodstream. Conversely, certain antifungal medications, such as ketoconazole, fluconazole, and itraconazole, inhibit Tadalafil metabolism. This can lead to excessively high levels of the drug in the system, increasing the risk of side effects and making the medication unsafe if not closely monitored. Second, excessive adrenaline and stress. Adrenaline, also known as the stress hormone, is the body's natural anti-erection agent. It acts as a powerful vasoconstrictor, tightening blood vessels and reducing blood flow to non-essential systems, including the sexual organs. During periods of stress, anxiety, or emotional tension, the body releases large amounts of adrenaline, either chronically or acutely. This directly counteracts the vasodilatory effects of Tadalafil. In younger men, particularly those under 40 with no apparent hormonal or vascular issues, the primary cause of erectile dysfunction is often psychogenic. This is typically due to performance anxiety or chronic stress, which elevates adrenaline levels to the point where it inhibits not only natural erectile function, but also the pharmacological assistance provided by Tadalafil. Third, consumption with heavy, fatty meals. Yeah, you heard that right. Tadalafil is absorbed through the gastrointestinal tract. Consuming the medication alongside large, fatty meals can interfere with its absorption, reducing its effectiveness. High-fat foods slow gastric emptying and may alter drug solubility, leading to decreased bioavailability. For optimal results, it's advisable to take Tadalafil on an empty stomach or with a light meal. Okay, so the next thing is excessive alcohol consumption. Alcohol is a central nervous system depressant. An erection requires the synchronized functioning of psychological, neurological, hormonal, and vascular systems. Sexual arousal starts in the brain, triggering a cascade of signals that lead to the release of nitric oxide and ultimately vasodilation. However, excessive alcohol impairs the central nervous system's ability to initiate this process. It dulls mental arousal and reflexive responses, effectively short-circuiting the brain's ability to send the right signals. Additionally, alcohol itself acts as a systemic vasodilator. It can divert blood away from the pelvic region, reducing the amount available for penile erection. It's not uncommon for patients to report taking Tadalafil at a social event or party and still experiencing erectile failure due to high alcohol intake blunting the neurological and vascular response. And lastly, we have lack of sexual stimulation. As emphasized earlier, Tadalafil is not an initiator of erections, it is a facilitator. Its effectiveness hinges on the presence of sexual stimulation. The process begins in the brain, and without a mental or physical stimulus to trigger the arousal pathway, Tadalafil simply cannot exert its full potential. This is quite different from intracavernosal injections, such as Trimix or Bimix, which can sometimes produce erections even in the absence of sexual arousal. Oral PDE5 inhibitors like Tadalafil, however, depend entirely on the brain's initiation of the erectile cascade. A man who takes Tadalafil without engaging in any form of sexual stimulation is unlikely to achieve the desired result. If you found this information helpful, or if you believe it could help someone you know, please consider sharing this video. Spreading accurate medical information is a simple yet powerful way to help others improve their quality of life. Don't forget to subscribe to the channel and enable notifications so you never miss a new video. Thank you for watching, and I'll see you in the next video.